You just cut your hand. You wash the wound, bandage it, take a painkiller, and if it is more serious, you go to the hospital. A doctor stitches it up in 20 minutes. You go home, watch Netflix, and forget all about it. Now take all of that away. No medicine, no doctors, no hospitals, no antibiotics. Just you, a bleeding wound, and a dark wilderness surrounding you. A deep cut that is not treated properly can kill you within days, not because of blood loss, but because an infection quietly eats its way through your flesh, inch by inch, from the inside. That was the reality of your ancestors for hundreds of thousands of years. And somehow they survived. You are proof of that. So what did they do? Before we go into the details, let's be honest about what they were facing. Because no doctors sounds inconvenient, but the reality was far worse. There was no concept of germs. No one knew why wounds became swollen and filled with pus. No one understood why someone could develop a high fever and die a few days later from nothing more than a thorn stuck in their foot. To them, illness was something mysterious, perhaps a punishment from the gods, perhaps a spirit entering the body, perhaps a curse. But here is the remarkable part. Even without understanding why, they still figured out what worked, not through textbooks, but through thousands of years of observation, trial and error, and the hard lessons paid for by countless people who died so that others could learn. That was their medicine, and it was far more effective than you might think. The earliest evidence of ancient medicine comes from a site in Iraq's Shanidar cave, around 60,000 years ago. Archaeologists discovered the remains of a Neanderthal buried alongside a large amount of pollen. It was not random. Analysis showed that the pollen came from at least 8 different plant species, many of which are still used medicinally in the Middle East today: plantain, yarrow, and ephedra. They did not know the scientific names. They did not understand the mechanisms behind them. But they knew that pressing one type of leaf onto a wound helped stop bleeding more quickly. They knew that boiling the bark of a certain tree could reduce fever. They knew that applying a particular plant resin could keep a wound from rotting. And they were right. Modern research has confirmed that many of the herbs used by ancient people contain genuine antibacterial compounds. Yarrow, a common wild plant, can help slow bleeding and has mild antibacterial properties. Wild garlic produces allicin, a compound that kills many types of bacteria. Pine resin contains terpenes, natural antimicrobial substances. They did not know why these things worked, but they knew that they worked, and that was all they needed. This is the part that most people do not believe until they see the evidence. Ancient humans performed surgery, not heart transplants or kidney replacements, but actual surgery with tools, with techniques, and with surprisingly high survival rates. In 2023, archaeologists reported the discovery of a skeleton on the island of Borneo dating back roughly 31,000 years. The skeleton was missing the lower part of its left leg, and the astonishing detail was that the bone had healed completely. That means the individual lived for years after the amputation. Someone had amputated their leg, intentionally, carefully, and in a controlled manner, and that person survived. What were their surgical tools? Sharpened stone blades. It sounds primitive, but a properly crafted obsidian blade can actually be sharper than a modern surgical scalpel, sharp enough to cut through cells rather than tear them apart. Some modern eye surgeons have even experimented with obsidian blades for this reason. And there was another type of surgery that is even more shocking: skull drilling. Trepanation, drilling a hole into the skull, is the oldest surgical procedure recorded in human history, appearing on at least 5 different continents. Skulls from France dating back around 7,000 years show clear signs of healing around the drilled openings, meaning the patients survived. At some archaeological sites, survival rates have been estimated at as high as 70%. They drilled into human skulls, without anesthesia, without antibiotics, and without sterile operating rooms, and 7 out of 10 patients survived. Think you have a high pain tolerance? Think again. Now let's return to basic wounds, cuts, punctures, and tears. These were injuries ancient people encountered every day, and they developed remarkably practical ways to treat them. Honey. Ancient Egyptians used honey to dress wounds at least 4,000 years ago, and now we know why it worked. Honey has powerful antibacterial properties, draws moisture away from bacteria, and creates a protective barrier that helps prevent infection. Modern medicine still uses medical-grade Manuka honey for chronic wounds that struggle to heal, spiderwebs. It sounds disturbing, but there is scientific reasoning behind it. Ancient people, in many different cultures, independently used spiderwebs to dress wounds. The proteins found in spider silk have antibacterial properties and can help blood clot more quickly. Modern researchers are developing medical materials that mimic the structure of spider silk, tree resin. People across the world, from North America to Southeast Asia, use pine resin and other plant resins to seal wounds. Resin creates a waterproof barrier, helps prevent bacteria from entering, and, as mentioned earlier, contains antibacterial terpenes. This was not superstition. It was experimental science. They simply did not have a word for it. The skeletons of ancient people frequently show signs of healed fractures, sometimes perfectly healed, sometimes healed crookedly, but healed nonetheless. Someone helped them. Immobilizing a broken bone is the most important step in allowing it to heal properly, and ancient people understood this. They used wood, branches, and strips of bark secured with animal sinew or plant fibers to splint broken bones. Evidence from ancient Egypt, dating back about 3,500 years, shows bone splints so sophisticated that modern doctors who examine them often remark that the basic technique is not very different from what is used. Today, that means that for tens of thousands of years before that, humans had already discovered and passed down this knowledge without books, without medical schools, simply through oral tradition from one generation to the next. Not everyone treated their own illnesses. In every ancient human group, there was usually one person or a small number of people who specialized in healing. We call them healers, shamans, or medicine men and women. But their role was real and important. These individuals spent years observing which plants had which effects, during what seasons they could be found, what dosage was effective, and what dosage became poisonous. This was knowledge accumulated over many generations and passed down carefully as one of the community's most valuable possessions. A 2012 study analyzing the remains of an individual from Denmark, dating back about 3,500 years, found that this person lived into old age despite having been partially paralyzed since childhood, unable to fully support themselves, unable to hunt, and unable to gather food. The community cared for this individual for decades. That does not merely demonstrate kindness. It suggests that this person was important enough to the community to be supported despite contributing little physical labor. It is very possible that this individual was a healer, someone who carried the medical knowledge of the entire group. Now, imagine this for a moment. Your ancestor is sitting there with an arrow driven through their shoulder. No anesthesia, no antibiotics. The group's healer uses a sharpened stone to cut into the flesh, remove the arrowhead, pack the wound with tree resin and spider webs, then bind leaves over the top. The patient remains fully conscious throughout the entire process and is not allowed to cry out because it could attract predators. And then that person survives. A few weeks later, they are hunting again, and you get a mild headache and immediately Google brain cancer symptoms. You get one mosquito bite and start searching for early signs of dengue fever. You catch a cold and spend a week lying around complaining on social media as if you are living through your own personal pandemic. These people with bare hands, no medicine, and no understanding of bacteria performed surgery on one another, drilled holes into human skulls and kept the patients alive, and discovered natural antibiotics tens of thousands of years before Alexander Fleming discovered penicillin. They had no choice but to become tough and intelligent. And here is the part I cannot stop thinking about. Most of the knowledge they accumulated thousands of years of observation, experimentation, and lessons paid for with human lives has disappeared. Entire cultures were wiped out, languages went extinct, and healers died with no one left to inherit what they knew. We have rediscovered some of that knowledge, and each time we do, we are amazed by how much they got right. Not because they were lucky, but because they paid attention very, very closely. That was the only thing they had. And it turns out, it was enough.